Your care is at the center of a crisis experts say involves the entire healthcare system.
Each year until 2032, the U.S. will see nearly 200,000 job openings for registered nurses. And the reason that affects you? Researchers say higher nurse-to-patient ratios can raise the likelihood of errors and decrease patient satisfaction.
In order to help keep nurses at patients' sides, a support organization offers retreats for nurses by nurses.
Reporter Adrian Thomas takes us there and uncovers part of the problem behind the shortage.
And we never healed from that. They just give you a pizza party and say it's time to move on. Like, COVID's over, here we go. Yeah. And it's like nobody gave us an opportunity to heal.
For registered nurse Heather Sweeney and therapist Amy Ponteri, taking care of those who take care of us in emergencies has become their mission. It began several years ago when both felt there just weren't enough resources for those who work in the most intense healthcare settings like emergency rooms, and they know from personal experience.
There's got to be a better way to do this. Like, we've got to figure out a way for us to take care of ourselves better, for us to take care of each other better so we can sustain, because we're just dropping right and left.
Both shared stories of working in ERs during the pandemic and its aftermath, describing the emotional and physical toll it took.
And then you get all these text messages every day of open shifts, and you feel like you should go pick it up because you don't want to leave your teammate down, but then all of a sudden you've worked 60 hours in the week.
While they acknowledge some hospitals and healthcare groups provide employee assistance programs to address the mental health strain on healthcare workers, the two felt more needed to be done and started Helping Healthcare Heal, where Sweeney and Ponteri offer retreats, support groups, and even continuing education for healthcare workers. We caught up with some of the nurses who take part in the activities. They described the experience as eye-opening and rejuvenating.
I realized I had time to process some really intense things that I've gone through in the last year or two that I had not had time to do. And that there were so many tears.
It was just like something new happened to me inside myself, and just being with the other women, hearing their stories, learning from the ladies, and just came back empowered.
According to the Oregon Center for Nursing, Oregon has more licensed nurses than ever before, but 30% of new nurses leave their first jobs out of nursing school within their first year. Christy Simila is the director of professional practice at the union representing many Oregon nurses, the Oregon Nurses Association. Simila is also a registered nurse with over a decade of experience prior to her current role.
My belief is that in Oregon, we don't actually have a nursing shortage. What we have is a vacancy crisis, and that's because of persistent unhealthy work environment, increased stress, increased workplace violence.
Simila says in her experience, many nurses are taking jobs that are adjacent to frontline healthcare settings, such as nurse coaches, consultants, or in call centers doing triage, jobs outside the traditional nursing roles.
So I think hospitals can really start by listening to their nurses and what the nurses need, and really working to create a more healthy work environment, working to create a safer work environment where nurses aren't showing up and potentially being subject to workplace violence as often.
A law in Oregon aims to address the shortage with new rules on how many patients a nurse can care for at one time. As of fall 2025, just 3 other states, California, New York, and Massachusetts, have implemented similar nurse-to-patient ratio legislation.